And if you remember, what do I mean by home? Home is the environment. And stasis means stability. So homeostasis simply means the stability of the environment. And what environment are we concerned with? We're concerned with the body's internal environment. So by definition, homeostasis is the ability to maintain a relatively stable internal environment. What this means? This simply means that whatever imbalance that will be taking place will be adjusted back to normal. Like, for example, if you remember an example that we've discussed last class, if I'm running, for example, so I need to increase my blood pressure. So during rest, my blood pressure is 120/80 millimeter mercury. But when I run, my blood pressure goes up, let's say, to 160/100. Will my blood pressure remain high forever? No, it won't. My body has the ability to get it back to normal, to lower it down back to normal. Another example that we've mentioned last class was whenever you eat. Whenever you eat, what happens to your blood sugar level? Your blood glucose rises beyond the normal levels. So how your body responds? It's gonna be lowering down the glucose levels back to normal for you to maintain a stable internal environment. That's why we use relatively stable. Because sometimes it's gonna go up, sometimes it's gonna go down, but your body will try its best to get it back to normal standards. This will be applied to everything. So if I have a drop in my blood oxygen levels, or I have an increase in the carbon dioxide levels, and this what's going to happen if I am running, for example, a sprint. My blood oxygen level is going to be trying to drop below normal, and my carbon dioxide levels will be increasing because of the contraction of my muscles when I run. So in order for the body to maintain normal oxygen levels and carbon dioxide levels in the blood, what it will do, it will increase the rate and depth of breathing. So I will be breathing faster and deeper, and this will be allowing an increase in my blood oxygen levels back to normal, and will allow me to get rid of the extra carbon dioxide that got produced from the muscular contraction. So I will be able to reduce the carbon dioxide levels back to normal. So you see here, I'm trying to maintain a stable internal environment. Remember, what are the components of a control mechanism? Remember, whenever I have a change that takes place either in the internal environment or the external environment that affects me, this is what we call a stimulus. First, you need to be able to detect that there is a change. This is the very first thing. How would I respond to something I don't know that it exists? I can't. So first thing, I need to have receptors to detect the presence of a change. I have an increase in the blood pressure, I have a reduction in my blood pressure, I have an increase in my blood calcium level, I have a reduction in my blood calcium level. So I have receptors that will allow me to detect that there is a variation of the normal levels of the stable environment. Again, we call the change that takes place is the stimulus. The parts that are detecting the stimuli, those are what we call the receptors. What the receptor will do, the receptor sends out signals to a control center. And remember, we mentioned two organ systems that will be acting as control centers. One that acts by sending out electrical impulses through the nerve fibers. This is my nervous system. And another one that acts by sending out chemical messages called hormones in my bloodstream. And this is what we call the endocrine system. Those are my control centers. So now the control center is aware that there was a change. I did have, for example, a drop in my blood glucose levels. A drop in the blood glucose levels is here in this example is going to be the stimulus. This is a change that took place. I have receptors that will detect this change, and I'm sending out the signal to an endocrine gland, the pancreas, for example. Here in this example, it's going to be the pancreas. How the pancreas responds, it sends out its message. And the message here is going to be in the form of a hormone because I'm an endocrine gland. And the hormone I'm releasing is called the insulin. So what the insulin will do, it stimulates the fat cells to get the glucose from my blood and to be stored inside. So what happens to the, sorry, I did have an increase in the blood glucose level first. Increase in the blood glucose level. So if I have high blood glucose and I stimulated the adipose cells or the fat cells to uptake this glucose to the inside for it to be stored. So what's going to happen as a result of uptaking the glucose from the blood into the fat cells? The blood sugar level will drop back to normal. I have lowering down the blood sugar level. By this, I will be able to maintain normal blood sugar levels. So what did we call here the organs that will have an effect? In this case, it's going to be the fat cells. What do we call the organs that will have an effect? Those are my effector organs. And what results from responding to the stimulus? This is what we call the response. So the response here in this case is going to be a reduction. I'm uptaking the glucose to the inside, and as a result, I lower down the blood sugar levels. So again, what are the different components here of the control mechanism? First, I did have a stimulus detected by receptors. Receptors will send signals to the control center through the afferent pathway. Control center responds by sending out messages to the effector organs through the efferent pathway. Effector organs will have a response. So those are the 5 main components here of the control mechanism. Any questions? This is briefly what we've mentioned at the end of last class. Any questions? Anything which is not clear in this concept of homeostasis? All right, great. So we have 2 types of feedback. And the type of feedback is going to be determined according to the relationship. This is very important to keep in mind. The relationship between the stimulus and the response. If the response is reducing the stimulus, it's what we call a negative feedback mechanism. If the response is exaggerating the stimulus, we call this is a positive feedback. What this means? Let's check an example here. Outside is too hot. So this goes what to my body temperature? It's hot outside. I have, as a result, an increase in the body temperature. Who is located in my skin to detect that there is an increase in the temperature? I have receptors. Thermoreceptors are detecting the change in the temperature. Those receptors will do what? Will send out signals to the control center. In this case, it's going to be the nervous system. So how the nervous system will deal with this stimulus, the increased body temperature? It sends out signals to your skin. To be more specific, inside your skin, you have glands that are going to be responsible to produce sweat. So I'm stimulating here the sweat gland. So the effector organ is going to be the sweat glands. Sweat glands will become stimulated by the effect of the nervous system, and they will start to release the sweat. So this is my response, is to sweat. So what do you think is going to be the effect of sweating on my body temperature? I did start by an increased body temperature. What's going to be the effect of sweating on the body temperature? Will it increase it or reduce it? What do you think? Decrease. I have a reduction in the body temperature. I have a reduction in the temperature as a result. So the response here, I'm sweating, and as a result, I have a reduction in my body temperature. So what is the relationship here between the response and the stimulus? Is the response exaggerating or reducing the stimulus. What was the stimulus? Increased temperature. What was the response? Sweating, causing reduction of the body temperature. So here they are opposing each other. Response is opposing the stimulus. So what kind of feedback is this in which I am reducing the stimulus? It's called a negative feedback. All right. So let's see another example here. And you tell me whether it's going to be a negative feedback or a positive feedback. It's too cold outside. So my body temperature is dropping. Again, who's going to be there in my skin to detect the drop in my body temperature? I have thermoreceptors. And those receptors will do what? Will send out signals to my nervous system. As a nervous system here acts as a control center, it sends out signals to my skeletal muscles. So skeletal muscles here are going to be my effector organs. How would I respond to this stimulation? My muscles will start to contract. So I start to shiver. And if you remember, the skeletal muscle contraction results in what? In generating heat. This is my response. So what's going to be the effect on here on my body temperature when I generate heat? When I generate heat, generation of heat results in increase or reduction or decrease, an increase or a decrease in the body temperature, increase in the temperature, exactly. So you see on here, I have an increase in my body temperature. So this is my response. This is my response. Shivering, generating heat, resulting in an increase in the temperature. What was the initial stimulus? Reduction of my body temperature. So what do you think is going to be the type of feedback in this case? Is this a negative feedback or a positive feedback? All right, so let me go back here. I won't tell you the answer, but I will review the relationship here between response and stimulus. What is, by definition, a negative feedback? Negative feedback means that the response is doing what to the stimulus? Is shutting off or reducing the stimulus. Here, am I increasing or reducing the stimulus? What do you think? Am I increasing the stimulus? So increase, reduce. What do you think? So what is the stimulus again? Reduction in the body temperature. What is the response? An increase in the body temperature. Are those exaggerating each other, one another? Is the response exaggerating the stimulus or canceling the stimulus? It's canceling the stimulus. So they are, so the response here is gonna be reducing or increasing the stimulus. If the stimulus is a reduction in the body temperature and the response increases the temperature, so the increase of the temperature means a reduction in the decrease of the temperature. So the response here is doing what to the stimulus? It's canceling, it's reducing the stimulus. So this means it's what type of feedback? It's a negative feedback. Don't just look at what happened to the temperature. An increase in the temperature doesn't mean that it's a positive feedback. You're looking at the relationship between response and stimulus. If you see that they are opposing each other, one is an increase, one is a decrease, so this means it's a negative feedback. But if I did have, for example, something that when I have a reduction in the temperature will also reduce my temperature, now both are going down. So they are exaggerating one another. So let's see an example of a positive feedback. This is a uterus. And this is the vagina. And inside the uterus on here, we've got baby. So why would make this baby decide to go out? So the mother will decide to get him out? Contractions? So he's not paying rent, he has nothing to worry about, he's eating for free. It's so comfortable inside, even his mother's immune system is protecting him. Why would he get out? Because it become too tight for him. So now the uterus is too small for the baby. So the baby now started to do what? Started to stretch the uterus. Like any elastic band. Like any elastic band, when you stretch it, it recoils. Stretch, recoil, stretch, recoil. So muscle as well, same concept. When you stretch the muscle, it responds by contraction. So the initial stimulus is the baby first stretches the wall of the uterus, and the uterus here starts, as you've mentioned, to contract. This is a very initial stimulus. So let's start from this point. Stimulus here for me is a uterine contraction. Inside the uterus, we've got receptors that are going to be detecting the uterine contractions. And those receptors will be sending out signals to part of the brain called the hypothalamus that will be releasing a hormone. It's pending down from the brain. It's gonna be releasing a hormone called oxytocin. Oxytocin will be released from a gland pending down from the brain. It's called the pituitary gland. And this oxytocin will do what? It's gonna be released out. It's a hormone, so it gets released out in the bloodstream and will reach the effector organ. In this case is gonna be the uterus, stimulating the uterine muscles to perform further contractions. So what was the stimulus that I've got? Stimulus was uterine contractions. And what will be my response? More contractions. So more contractions means what? More stimulation to the receptors. And more stimulation to the receptor means more signals will be sent out to my hypothalamus, stimulating the hypothalamus to release more oxytocin that will be enhancing more of the uterine contractions. And more uterine contractions means more stimulation to the receptors. And more stimulation to the receptors means more excitation to the hypothalamus, means more oxytocin gets released, means more uterine contractions that will result in what? More stimulation and more contraction, more stimulation and more contraction and more stimulation and more contraction until when? Until the baby is out. All right. So what is the relationship between the stimulus and the response? You see on here, is the response is exaggerating the stimulus? Is this response exaggerating the stimulus or inhibiting the stimulus? It's exaggerating the stimulus. So if the response is increasing and stimulating the stimulus, this is what we call what kind of feedback? It's a positive feedback. Easy, easy. All right, for questions here that I've got. Yeah, the baby normally is the one who initiates the contraction, full-term baby. In some cases, abnormal uterine contraction can cause premature labor. Here we're talking about what's the normal. And normally, what initiates those uterine contractions is going to be the stretch applied to the wall of the uterus by the effect of the growth of the baby, the increase of the size of the baby. For the notes, those PowerPoints are already posted on Canvas, so you can get those PowerPoint presentations from Canvas, but those ones are accessible only during our meeting, because this is something I've never put down as notes. Like I don't have like a PDF file or something. All right. So for recordings, I only will be providing them to in very limited basis to people who did have something that prevented them from attending the live meeting. All right. All right. So let me. So here attending those meetings is gonna be mandatory for everybody to attend. So I don't want to have those recordings available for everybody, because if I made them available for everybody, it simply I won't have anybody attending the live meeting. And if I couldn't have anybody attending the live meeting, I will not be conducting it. So there will be no live meeting or recordings. You see my point? That's why I don't get them provided to everybody. All right. If in unlimited basis, send me a message on Canvas. Send me a message on Canvas if you were late one time or two times, and I will be happy to upload them for you and send them to you. But this is going to be unlimited basis. It's not going to be for everybody every single meeting. Last meeting was recorded, yes, and it will be sent to those who did not attend the first meeting. So when I put down the attendance of the last class, I will be sending out the recording to those who did not make it to the last meeting. All right, so another example of a positive feedback. Another example of a positive feedback is going to be when you injure a blood vessel. So this is my blood vessel like this. My blood vessel is covered on the inside by very smooth layer of cells. If the blood vessel got injured, this will expose collagen fibers that are gonna be lying down underneath this layer of cells. So how would I respond if I did cut one of my blood vessels? My body has fragments of cells that are normally circulating within my bloodstream called the platelets. And those platelets will have the ability, when they get exposed to the collagen fibers, in case of an injured vessel, to stick to the collagen fibers. And they will become activated and they will start to release chemicals in the bloodstream to attract more platelets at the site of injury. And as more platelets come here, so what was the initial stimulus in this case? Initial stimulus in this case is going to be activation of platelets. And as more platelets come at the site of injury, they will also stick to the collagen fibers. And as they stick to the collagen fibers, they will also become activated. They will start to release chemicals in the bloodstream. And as a result, more platelets will be attracted. And as they come, they will stick to the collagen fibers. They will become activated. They will start to release their chemicals. They will start to attract more platelets. As they come, they stick and become activated. And this here will become a positive feedback. The more platelets that get activated, the more platelets that will become activated. More platelets get activated, more platelets as a result will become activated. So this is going to be a positive feedback. The response is enhancing or stimulating the stimulus. So until what happens? Until all those collagen fibers that are exposed are going to be covered with platelets. We call this is a platelet plug, as if I have a plug of platelets filling this injured site in my blood vessel. And this is one of the earliest steps in hemostasis. This is one of the very early steps of hemostasis that precedes the coagulation. The coagulation or the formation of a blood clot is a three-step process. This is one of the three steps on here. All right, so we call this is again my platelet plug formation. So an example of a positive feedback. What if I have a disturbance in my homeostasis? Again, what's homeostasis? Homeostasis means the ability to maintain a relatively stable internal environment. My ability to maintain a relatively stable internal environment. This is homeostasis. What if I can't maintain homeostasis? So my blood pressure went up and I can't get it back down. This is what we call hypertension. When I eat, my blood sugar level, my blood glucose levels will rise, and I will fail to reduce the blood glucose level. Because, for example, I have type 1 diabetes. I'm not producing insulin. Or I have type 2 diabetes. I have insulin receptor problem. So this is what we call diabetes. What if I have an increase in my blood calcium level, but I can't lower it down? Hypercalcemia. That results in what? That results in kidney stones. That might result in renal failure. So you see on here, inability to maintain normal stability of the internal environment. This will result in a pathology, in a disease. So disturbance of homeostasis increases the risk of developing a disease. And this would be responsible of the changes that would be associated with aging. So why, when I get older, I am more likely to develop diseases? Because simply my body is not going to be functioning as effective as it used to to maintain a stable internal environment, to maintain homeostasis. So I'm more likely to develop diabetes than at earlier age. I'm more likely to develop hypertension. I am more likely to develop high blood cholesterol levels, and so on. So changes associated with aging is a manifestation of the inability of the body to keep homeostatic balance at normal levels in every single aspect. Are all feedbacks going to be beneficial? So is any response that my body will be taking is going to benefit me? What do you think? Yes or no? No. Like what? Like in, for example, some things that you see on TV on daily basis. Respiratory tract viral infection. The virus invades the lung tissue. Some will have exaggerated inflammatory response. And the inflammation itself causes the lungs to lose its function. As I am filling here and there fibrous tissue. So it's going to be more difficult for the person here to breathe. This is not directly resulting from the viral infection. This is indirectly resulting from the viral infection due to how your body going to be responding to the infection. So in some cases, your body will think, I want to attack this virus, so let's destroy the lungs. So as if you have a rat or a mouse in your house, and you are so afraid of mice. So what you're gonna do to get rid of the mice that get into your house? What do you think? What you're gonna do? If you get a mouse in your mouse traps, right? Yeah, this is a good thing. This is a good way. But some people, because they are so afraid, what they will do is they will burn the whole house to get rid of the mouse inside. All right, so your response doesn't essentially mean that it's going to be beneficial in all conditions. All right, you see here's the difference. So let's see another example on here of how a feedback can be destructive. If this is the wall of the heart, the wall of the heart, it's not an autoimmune. It's not an autoimmune. Here, it's a hyper immunological response, not an autoimmune. Autoimmune, I am attacking my own tissues. It might be triggered by an infection, but not essentially an infection. All right, autoimmune response, I activate my immune system to attack my own tissues. This is an autoimmune response. But here, it's an exaggerated immunological response to something that is harmful already. All right. So if we're looking here at the heart is going to be formed of cardiac muscles. And if you see on here, this is the blood vessels that carry the blood out from those large chambers of the heart. All right. Did you hear before about something called a myocardial infarction? Yes? What's a myocardial infarction? What's a myocardial infarction? Part of the cardiac muscles in the wall of the heart is dead. Heart attack, yes. Not just pain, this is angina. But an actual myocardial infarction most likely going to be due to narrowed blood vessels. So the blood vessel that gives the blood supply carrying the oxygen and nutrients to the cardiac muscle is narrowed because of, for example, one of the most common reasons is going to be accumulation of fat in the wall of the vessel called atherosclerosis. Atherosclerosis will cause a reduction in the amount of blood supply going to the wall of the heart. This gonna cause weakening of the muscles. But at some point, those plaques of fat will rupture and will cause the formation of a blood clot within the vessel. So now the blood vessel is totally blocked. So there is no blood supply going to this specific region in the wall of the heart. And as a result, can I survive? Can I survive without getting blood supply? I'm talking here about this specific region that is normally supplied by this vessel. Can I survive not getting oxygen, not getting nutrients? No. So what happens to the cardiac function? So let's say this is the weight of the blood that you want to carry. It's a cart, like a cart. And you have 10 horses to pull the cart. Now you've lost one of them. Now you have 9 horses only. What do you think? What will be the response of those 9 horses to carry the same load? Would you like them to work harder or to relax compared to before? So how would you think if you are asking those 9 horses, you need to perform the same as you were 10? Would those 9 horses be working harder or would they relax? If you're asking them to perform the same exact work, so they need to work harder. And if they need to work harder, would you need to supply them with more oxygen or less oxygen? You need to supply them with more oxygen for them to produce more energy that makes them able to work harder, right? But what was my initial problem? What was my initial problem? My initial problem is that I have narrowed vessels because I've accumulated. So this one is blocked, that causes the myocardial infarction. But the rest of the cardiac muscles are supplied by blood vessels which are not blocked yet, but they are narrowed. So here I'm increasing the demand of the cardiac muscles to oxygen. And as I increase the demand of oxygen, can I supply this extra demand of oxygen? No. So what's going to happen if you're asking a person or this horse to work harder, but you're not providing it with the oxygen needed for it to carry on this work? What's going to happen to this horse? You're asking him to work, and you don't feed him. What's going to happen to the horse? It dies. So another myocardial infarction takes place. And now I have 7 horses. I would ask them to work even harder to substitute the loss. Am I able to provide them with enough oxygen? Still not. So what's going to happen? Another myocardial infarction. So you see on here, a feedback. As a feedback, what was my response? I am asking the muscle cells to work harder. But this is a positive feedback that causes the destruction of the heart. So not every feedback is going to be beneficial. So in some cases, a positive feedback, like in myocardial infarction, it might end up causing heart failure. Why? Because I kept getting myocardial infarctions. That's why it seems illogical when you first read a prescription for a person who got a myocardial infarction and the doctor gives him beta blockers. What are beta blockers doing? They are reducing the work on the heart. I'm trying to relax the heart. Why? Because if a person got a myocardial infarction, he is at risk of getting another one. So I know that my problem is that I didn't have the ability to supply enough blood to the cardiac muscle. That's why in the first place, this myocardial infarction took place. So what will I do? Rather than pushing those remaining cardiac muscles to work harder, I will give a medication to reduce the workload on the living cardiac muscles. And that's why beta blockers will have a much better effect on a myocardial infarction patients in terms of increasing the life expectancy. So patients now live much longer than before on beta blockers. Why? Because we understand now that if we left the patient without giving him beta blockers, what he's going to end up with, he's going to end up with other myocardial infarctions, and it might result at the end in heart failure. All right, any questions? Any questions? All right, we can have a break for 10. We come back. Yes. So beta blockers are slowing down the heart. Yes, beta blockers will slow down the heart and will reduce also the force of contraction. So both, it's going to be slowing down rather than having faster contraction. I would be contracting much slower. This is one thing. And the other thing is that it will also reduce the force of contraction, not too much, but to the extent to not overload the cardiac muscles, for them to not need more supply of oxygen. All right. All right, we can have a break for 10. We will be back in 10. All right. All right, welcome back. We are looking at important anatomical descriptions on here. First is going to be the anatomical position. What's an anatomical position? This is a position according to which we're going to be describing all the anatomical relationship of the different body parts to one another. So for example, which one is located above or superior, your head or your legs? Which one is superior, head or legs? What do you think? What if you're lying flat on the bed? Which one should be superior? That would be the same. So we need here to agree on one specific position according to which we're going to be describing all the different body parts and the relationship to one another. We did agree that this position is going to be called the anatomical position. And the anatomical position here is that a person will be standing up, facing forward, and his palms are also facing forward, like this. So this is going to be superior. So the neck is superior to the back, to the chest, to the lower back, to the legs. This is going to be inferior. Another name that we use for superior, another words that we use for superior is cranial. And another name that we use for inferior is going to be caudal, tail. Other description we're going to be using if something is located away from the midline that splits the body into right and left. This is called lateral. If something is closer to the midline, is gonna be called medial. So according to the anatomical position, which one is gonna be lateral, which one is gonna be medial? My thumb or my little finger? Which one is medial, which one is lateral? So this is our first two questions for today's activity. So you are picking thumb or little finger. Number one is gonna be which one is medial, and number two is gonna be which one is lateral. So what do you think? Which one is located away from the midline in an anatomical position, the positions that you see on here on the PowerPoint? Which one is located away, closer to the midline? Which one is going to be medial? It's going to be my little finger. And which one is going to be located away from the midline? Lateral. Your thumb. Easy, easy. Another body direction and positions that we're looking at is going to be according to the point of origin. And this is going to be mainly used with the limbs. So the point of origin is the point of attachment to the rest of the body. This is the point of origin for the lower limb and the upper limbs. So what do you think? If I told you that if I'm located closer to the point of origin, this is called proximal. And if I'm located away from the point of origin, this is going to be distal. Which one is going to be proximal and which one is going to be distal? Number 3 here, my question is shoulder. And number 4 is elbow. Which one is closer to the point of origin? Shoulder or elbow? Which one is going to be proximal? Shoulder or elbow? Closer to the point of origin is going to be my shoulder. So shoulder is more proximal, exactly. Elbow is going to be away from the point of origin compared to the shoulder. So it's going to be more distal. So let's try another example on here. If I told you here, those are the bones of the hand. This is my thumb. This is going to be my little finger. And we have here other bones that we're going to discuss details later on. You see on here, This is here number 5, and this would be number 6. Which one should be called the proximal phalanx, and which one is going to be called the distal phalanx? Number 5 is located away or close to the point of origin. Number 5 is going to be away from the point of origin, so this is going to be more distal. Number 5 is more distal. And number 6 is going to be much more closer to the point of origin, so this is going to be more proximal. This clear? Clear. So seen here, superior, inferior. We've seen medial and lateral. We've seen proximal and distal. Like when you travel to any country in order to work in this country, what is the first thing? What is the first thing that you will need to learn? It's language. So in the medical field, we're going to be using specific terms to describe the different body parts. And this is what we are looking at in here. This is what we call the body landmarks. Something that will be related to the head is called cephalic. Something related to the anterior part of the head, it's gonna be frontal. Something related to the socket in the skull where you keep the eye, the circular socket, it's gonna be the orbit, and something related to the orbit, it's gonna be orbital. Something related to the nose. So if I told you I have a bone that forms my nose on here, or that shares in the formation of my nose, what would we call the bone of the nose? We call it my nasal bone. So something related to the nose is called nasal. So if a person had a polyp inside his nose, we call it nasal polyp. If I have a cavity inside the nose, we call it the nasal cavity. So nasal means something related to the nose. Something related to the mouth is going to be oral. So if I have a cavity inside my mouth, it's going to be my oral cavity. If I have an exam that I will only be using my mouth, is going to be an oral exam. Oral means related to the mouth. Related to the chin here is called mental. So when we study the mandible later on, we're going to see that the mandible that looks like this. Will have a hole related to the shin. So what do you think we're gonna call this hole related to the shin? It's called my mental foramen. Foramen is a hole, and mental means related to shin. So mental foramen. And related to the neck is called cervical. Related to the chest is called thoracic. So if I have a cavity within my chest where I keep my lungs and heart, this is what we call the thoracic cavity. So thoracic means related to the chest. Related to the chest is thoracic. Related to the armpit, it's called axillary. So if I told you that we've got an artery here, that will be traveling first through the armpit. So we're gonna call this part of the artery is my axillary artery. Related to the breast is called mammary. As also we're gonna see later on, we're gonna learn that the breast has milk secreting glands. So what would we call those glands that are located in the breast? Those are the mammary glands. Mammary means related to the breast. Related to the middle bone on here, the central bone located in the chest, this is called sternum, and something related to it is gonna be sternal. So if you touch the base of your neck in here, you will see a notch, a depression, just in the middle of the base of your neck in here. This is a notch in the sternum. So what do you think we're gonna call this notch in the sternum? What do you think we're gonna call this notch in the sternum? Exactly, sternal notch. So related to the sternum is sternal. If you kept moving here, this is my sternal notch. If I kept moving down, I would see an elevation just below it here. So what we're gonna call this elevation, this angle, this is my sternal angle. So something related to this bone here, the sternum, is called sternal. Moving down, related to the belly, it's gonna be abdominal. So if I have a space in the belly, it's gonna be the abdominal cavity. If I have organs located in this cavity, those are called the abdominal organs. So related to the belly is gonna be abdominal. Going down from the abdomen, we're gonna have the pelvis, and something related to the pelvis is gonna be pelvic. So if I'm describing the organs located within the pelvis, those are my pelvic organs. Pelvic organs. Like what pelvic organs? Like the urinary bladder, like the uterus, like the rectum, all those are pelvic organs. So related to the pelvis is going to be pelvic. Related to the groin, it's going to be inguinal or inguinal. So if a person has a skin pouch and in which he has part of his intestines protruding outside, coming out from or in the groin region. So what would we call this as? If I have a skin pouch in which I have intestines protruding out in the groin region, what would you write on your report? Yeah, hernia is a skin pouch in which we've got intestines. So to be more specific, coming out in the located in the groin region. So what would you call it? Groin in the groin region. So inguinal hernia. Inguinal hernia, exactly. This is going to be inguinal hernia. Related to the external genitalia, it's going to be something related to the external genitalia. It's going to be pubic. So hair related to the external genitalia, what do we call it? We call the hair here, it's pubic hair. Related to the shoulder is called acromial. Related to the arm is called brachial. So remember this artery that was traveling in the armpit, we called it axillary artery. So if this artery actually it moves down in the arm, so what do you think we're gonna call this artery as it moves down in the arm? It was called axillary as it moves in the armpit. When it moves down to the arm, what do you think we're gonna call this artery? Brachial artery. Brachial artery, exactly. Anterior aspect of the elbow is going to be antecubital. This depression in the anterior aspect of the elbow is the cubital fossa. Moving down to the forearm, it's going to be antebrachial. Antebrachial. Related to the wrist is going to be carpal. So if I told you here in the wrist region, we've got cubical shaped bones forming the wrist. So what do you think we're going to call this set of bones, those tiny little bones in the wrist? What do you think we're going to call them? Those are my related to the wrist is called carpal. So what do you think we're going to call those bones, those tiny little bones? My carpal bones. Related to the hand is manus. Related to the palms is going to be palmar. Related to the thumb is going to be pollex. Related to the fingers, it's going to be digital. Digital. Moving down to the lower limbs, related to the hips is called coxal. So the hip bone, another name for the hip bone, is going to be the coxal bone. And this is the bone that shares in the formation of the pelvis. You see on here, this is one of the two hip bones that we've got. Another name for this hip bone is going to be the coxal bone. So related to the hip is coxal. Related to the thigh is called femoral. Femoral. So if I have a large artery here that traveled down in the thigh, so what do you think we're gonna call this large artery? It's my femoral artery or femoral artery. Related to the posterior aspect of the knee is called popliteal. So if I told you that this femoral artery is going to be traveling backwards, passing in the posterior aspect of the knee. So what do you think we're going to call this artery as it travels in the posterior aspect of the knee? It's my, here, this is my popliteal artery. Exactly, popliteal artery. In the anterior aspect of the knee, we've got the kneecap, and this is what we call the patella. So something related to the patella or the anterior aspect of the knee is going to be patellar. So as we're going to see later on when we study the bones, we're going to have the bone that would be forming the main part of the skeletal system of the thigh. This is called the femur. And it articulates like this with this triangular shaped bone. This is called the patella. It will have a smooth surface that allows it to articulate with the kneecap. So we're gonna call this surface to which the patella is articulating, this is my patellar surface. So something related to the patella is called patellar. Anterior aspect of the leg is going to be crural. Compared to the posterior aspect is going to be, you see on here, sural. Related to the ankle is going to be tarsal. So if I'm looking here at the bones of the foot, you're going to see cube-shaped bones like this. So what do you think we're going to call those bones forming the ankle? Those are my tarsal bones. So tarsal means related to the ankle. Related to the lateral four toes is going to be digital. Related to the big toe here is going to be hallux. Remember, what was something related to the thumb? Related to the thumb was pollex. Related to the big toe is going to be hallux. So pollex, hallux. Looking at important body landmarks from the posterior aspect, if we're looking on here, look related to the posterior aspect of the head, it's called occipital. So what was the anterior aspect of the head? Can you remind me, please? Anterior aspect of the head? Anterior aspect of the head? What did we call it? Frontal. Frontal. Frontal, exactly. Posterior part is going to be occipital. Occipital. Another important region on here that you can see from the back is the region between the chest and the pelvis. This is called my lumbar region. Lumbar. So if I have my vertebrae divided into regions, so I have a set of vertebrae located in my neck. So what do you think we're going to call the set of vertebrae in the neck, in this region on here? Cervical vertebrae, exactly. And I have another set of vertebrae that will be traveling, sharing in the formation of my chest. Something related to the chest is called thoracic. So what do you think we're going to call those vertebrae located in the chest? Those are my thoracic vertebrae. And I have a set of vertebrae located in the region between the chest and the pelvis. So what do we call this region again? It's my lumbar region. So what do we call this set of vertebrae located here? Those are going to be called my lumbar vertebrae. Related to the sacrum is going to be sacral. Related to the buttocks is going to be gluteal. Gluteal. The region between the external genitalia, can you remind me, what do we call something related to the external genitalia? Something related to the external genitalia is pubic. Located between external genitalia and the anus. We've got a region in between, so if we're drawing here a cut section of the body here, this is going to be the rectum, anal canal, and the opening here, this is the anus. And anterior to the rectum in females, it's going to be the uterus like this, and the vaginal opening. And anterior to it, we've got the urinary bladder and the urethra. So what is the external genitalia in females? We're going to have the clitoris. We've got the lips on here that will be surrounding. Those are the labia majora, labia minora. So the region in here between this external genitalia and the anus is called perineal. Same concept with the male. right? So we've got the rectum, we've got the anal canal, we've got the opening of the anal canal. This is the anus. Anterior to it, we've got here the urinary bladder with the urethra, and the urethra is traveling through the penis. And pending down here is going to be the testis within the scrotum, like this. So this is going to be the external genitalia. Is this something related? External genitalia is pubic. How about the region in between the external genitalia and the anus? This is called, again, perineal. So if a person came to you and you are the nurse, telling you, I've got abscess in here, a pouch filled with pus due to bacterial infection. So what would you write down on your report? You would come that the patient came with perineal abscess. You will not write on your report that the patient came with an abscess between external genitalia and anus. All right, makes sense why we need to know those terms? Does it make sense why do we need to know those terms? Those are the words that you're gonna use to be able to describe what you see. It's very, very important to start from today to study those body landmarks. It's highly, highly, highly important because we're gonna use those terms when we study the skeleton. We're gonna use those terms every time we're gonna be studying a specific anatomical topic. We're gonna be using those terms over and over and over. Related to the foot is gonna be pedal. 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 So when you are riding a bicycle, what you're gonna be doing, you're gonna be pedaling. You're gonna be using only your foot. Those are the most important ones for us for now. We're gonna keep adding to those body landmarks as we keep going throughout the semester. All right, but those are the very basic terms that you need to start working on from today. So if a person came to you and you are the nurse in the emergency room, he told you, I have pain in here, or pain in here, or pain in here, or here. What would you write down on your report? This is the chest, by the way, here. This is the lung, those are the lungs like this. So patient came with pain in here. So what would you write on your report? You're gonna write down abdominal pain, right? Here, abdominal pain, here, abdominal pain. So you see, it's not that specific. So for example, pain in this region might be a myocardial infarction. Why? Because you see, the heart is sitting on the diaphragm. This is very close to the heart. So a myocardial infarction might be manifested as abdominal pain. Compared to something like this here, most likely going to be constipation. So you need to be more specific in your description. So you can't consider all this as abdominal pain. This is too vague. All right, so you need to be more specific about what is the region in the abdomen where the patient came with pain in. All right, so what we did, we divided the abdomen and pelvis into smaller regions for us to be able to have a better idea about what's the cause of a pain or what is the cause of the problem. So we divided here the abdomen and pelvis into 9 regions. Related to the umbilicus, we're going to call this is the umbilical region. How about here? Something related to the belly, as we agreed, we gonna call it abdominal. But another term that we usually use is also gastro. Gastro is stomach. Something related to the stomach. So also we use the term gastro to describe something related to the abdomen. So we're gonna call this as the region above in the abdomen. Something above or on top is what we call, what we use to describe it, we use epi. So we're gonna call this region my epigastric region. Compared to something low or below. So this is below in the abdomen. Below in the abdomen. So if I have decrease in my blood pressure, what do you call decrease in the blood pressure? I have low blood pressure. What do you think? Or let me make it easier. What do you call high blood pressure? High blood pressure is hypertension. So what is low blood pressure? Hypotension. So low means, or below is hypo. So what do you think we're going to call this region located below in the abdomen? If the one located above in the abdomen is epigastric, what do you think we're going to call the one below in the abdomen? It's my hypogastric region. Hypogastric. So we've got epigastric, umbilical region, and below here in the middle is going to be hypogastric. So let me increase the chest. All right, so let's see on both sides. If you check here, I wanna want to show you here how the ribs are attached to the sternum. You see, those are my ribs, and this is going to be the sternum here. This is the sternum, and those are my bony ribs. If you notice, the ribs are attached to the sternum by cartilage. We call those cartilages mycostal cartilages. So if you notice on here, all this part is formed of cartilage. All this part is formed by cartilage. And something related to the cartilage, we call it here, this is the cartilage that we've seen attaching the ribs to the sternum, like this. Something related to the cartilage is called chondro. So as we're gonna see, the cartilage cells, so we're gonna call them chondrocytes. So this is the region on here on both sides that is located below the cartilage. So something below, we call it hypo. So we're gonna call those regions on here located below the cartilage. This is my, those are my hypochondriac regions. Hypo, below, chondro, cartilage. So I am located below the cartilage. Those are my right and left hypochondriac regions. And can you remind me, what do we call something related to the groin? Something related to the groin. Do you remember? Something related to the groin is inguinal or inguinal. Something related to the groin is going to be inguinal or inguinal. So we're going to call those regions down here. Those are my inguinal or inguinal regions. Another name for them is going to be iliac region. All right. Anything that is confusing? Everything makes sense. Everything makes sense, right? So we call the upper part in the middle epigastric, above in the abdomen. The lower part in the middle, below in the abdomen, hypogastric. Related to the umbilicus is going to be umbilical region. On both sides, right and left, just below the cartilage, of the chest, this is going to be my right and left hypochondriac regions. How about going down on both sides? This is going to be my right and left iliac or inguinal regions. All right. Can you remind me, what did we call the region between the chest and the pelvis? Do you remember from the previous slides? What do we call the region between just chest and the pelvis? Remember, we called it, remember, between the chest and the pelvis. Remember this region? What do we call it? Lumbar. So what would we call those abdominal regions located between the chest and the pelvis on both sides? Those are my right and left lumbar regions. Easy, easy. So again, if I'm drawing here, this is the lower end of the sternum like this. And this is the cartilage attaching my ribs. To one another and to the sternum. So we're going to be dividing the abdomen into how many regions again? Got 9 regions. Related to the umbilicus is going to be umbilical. Above in the abdomen is above in the abdomen, epigastric. Below in the abdomen, hypogastric. Just below the cartilage of the chest on both sides, it's my hypochondriac. Right and left hypochondriac regions. Going all the way down, related to the groin, it's my right and left iliac or inguinal region. Between the chest and the pelvis is going to be here. This is my lumbar region, right and left lumbar. So what do you think is going to be the reason for pain in the epigastric region? So what would you think of if a person came telling you he has pain in the epigastric region? The very first things that you will think of is going to be GERD. So the stomach is allowing acids to travel into the lower esophagus, causing heartburn. This is the very first thing I would think of. After I eat, I have pain in my epigastric region, first thing I would think of is going to be person has reflux, gastroesophageal reflux disease. What do you think might be the reason for patient coming with here pain in the right hypochondriac region? Pain in the right hypochondriac region. What do I have in here? I have the liver and the gallbladder. So liver and gallbladder. So what might cause pain in the right hypochondriac region? What would you think of? Person might have an inflammation of the liver, hepatitis, acute hepatitis. Or he might have an inflammation of the gallbladder, or a stone blocking the bile duct of the gallbladder. I has cholecystitis, or gallbladder stone. So this is what will come to my mind with a person coming with acute pain in his right hypochondriac region. What about left hypochondriac region? Person might have an enlarged spleen, for example, that causes tension, dull pain in the left hypochondriac region. Patient coming with lumbar pain. What would you think of? Pain that starts in the phalanx, in the lumbar region, and is gonna be referring to the external genitalia. Most likely it's gonna be something related to kidneys, like a kidney stone got impacted in the ureter. Something related, a 60 years or 70 years old male came to the hospital with left iliac pain. What do I have in here? Left iliac pain. Why left iliac pain? This is the site where of part of the large intestine called the sigmoid colon, and as you see on here, it's flexed. It's flexed. Why 70 years old male? Because most likely those are the people who will have constipation for a long time. So because of the weakening of the muscle contraction, so what they have is impacted fecal stones. So whenever you see a 70 years old male coming to the emergency room having left iliac pain, the first things that will come to your mind, this patient might have chronic constipation. How about here? Young adult came with acute left iliac pain, appendicitis, inflamed appendix, and so on. So you see on here, abdominal pain is too vague. It doesn't give me an idea about what should I be looking at. Each set of problems on here, according to the region, will be guiding you to take specific measures. So here I will check the liver enzymes. Here, epigastric pain not related to eating, or sometimes related to eating and exertion. So I might need to perform an EKG because this might be a manifestation of a myocardial infarction. All right, so according to the specific region, you would be guided on how you would be managing this patient. All right. Any questions? Any questions? Is it clear why we do divide the abdomen into smaller regions? Right, great. All right, so looking here at the body sections. So a section that splits the body into right and left parts, it's called sagittal section. If the so here, if I am performing a cut here, it's a sagittal section. Here, sagittal. Here, sagittal. All those are sagittal sections. The sagittal section that travels through the midline, it splits the body into two identical halves. This is a special type of sagittal sections. We call it mid-sagittal. So mid-sagittal is a sagittal section, but it simply travels through the midline, splitting the body into two identical halves, not just right and left parts. A transverse section is the section that splits the body into an upper part and a lower part. So I have part above this section and the other part is below this section. So this is what we call a transverse section. Transverse section. Like, where would we see transverse section? When you are looking at the images coming from an MRI. You'll see transverse sections of the abdomen, transverse sections of the brain, transverse sections of the pelvis, of the chest. A section that cuts the body into an anterior part and the posterior part, anterior and posterior, this is called, you see on here, frontal section. Frontal section. Frontal section. Like when you check a chest x-ray, I'm looking at the anterior posterior view. So it's going to be a frontal section. So again, three sections here that we have that will be dividing the body into parts, not essentially halves. If I'm traveling to cut the body into right and left, this is called again sagittal. The sagittal section that splits the body passing through the midline, this is what we call mid-sagittal. The section that splits the body into an upper part and a lower part, it's called transverse. A section that splits the body into an anterior part and a posterior part, this is frontal section. Frontal section. Any questions before we move on? Questions? All right. So we're looking here at the different body cavities. We have two main cavities. We have the ventral or anterior body cavity and the posterior body cavity or the dorsal body cavity. Ventral means anterior, and dorsal means back, so dorsal means posterior. So we have an anterior body cavity and the posterior body cavity. What is the posterior body cavity or dorsal body cavity is formed of? You see on here, it's formed of the cavity where you keep the brain. This is called the cranial cavity, and the cavity that travels through the vertebral column where you keep the spinal cord. So we call this is my vertebral cavity. So dorsal body cavity or posterior body cavity, this is what we will divide into cranial cavity and vertebral cavity. Cranial cavity and vertebral cavity, those are the two cavities on here forming my dorsal body cavity. The anterior or ventral body cavity, if you see on here, this will include the cavity located in your chest. And remember, something related to the chest is called thoracic. So we're going to call the part of the ventral body cavity located in the chest, this is my thoracic cavity. We have another body cavity on here, which is located to the in the abdomen. So we're gonna call this cavity related to the belly, gonna be my abdominal cavity. Abdominal cavity. And the third cavity that we can see on here, this is the one located within the pelvis. So we're gonna call this cavity on here, it's the pelvic cavity. So again, all the three cavities, the one in the chest, then in the abdomen, then in the pelvis, all the three of them are parts of the ventral body cavity or the anterior body cavity. We do divide the thoracic cavity into smaller cavities, smaller regions. Two cavities that are surrounding the lungs, those are gonna be my pleural cavity. Pleura is the membrane that surrounds the lungs. So we're gonna call this the pleural cavity. This is the cavity where you keep the lungs. The cavities that surrounds the heart, remember peri means around. Like if I wanted to get the circumference of a circle, what do we call the circumference of a circle? If I want to measure it, what do we call it? We call it the perimeter. Meter length, and peri means around. So the length around, this is my perimeter. All right, so peri means around. So here, located around the heart, this is my pericardial cavity. Peri around, and cardio means heart. So the cavity around the heart is my pericardial cavity. Above, between the two lungs, we've got the superior mediastinum. Superior mediastinum. Questions? All right, so this completes our discussion for today.